Super quick before we start. Please subscribe, like this episode, and tell us in the comments which topic you want next. Those 3 tabs keep the series going. Welcome to episode 10 of Case-Based Scenarios on Micronutrients and Infant Feeding. We will connect real clinic scenarios to national policies on vitamin A and iodine and reinforce best practices in breastfeeding. Dr. Sharon, thank you for joining us.
Delighted. Keep 2 anchors ready for exams. India's vitamin A supplementation policy under the National Health Mission, first dose at 9 months with subsequent 6 monthly doses up to 5 years, and the National Iodine Deficiency Disorders Control Program, which targets universal use of adequately iodized salt at 15 parts per million or more. Quote those and you sound updated.
Scenario 1. Sangeeta brings 15-month-old Ananya, who keeps bumping into walls, especially in the evenings. I. What is this condition called? IV. Which nutrient deficiency causes it? And III. What immediate treatment schedule should we follow?
I. That sounds like night blindness. II. The usual culprit is vitamin A deficiency impairing rod function and epithelial integrity. III. Treatment uses the standard therapeutic 3-dose schedule for xerophthalmia. For children at least 12 months old, give 200,000 international units vitamin A on day 1, day 2 and again on day 14. For 6 to 11 months, the age-specific dose is 100,000 international units with the same timing. Under 6 months, 50,000 international units. Pair this with dietary counseling and management of intercurrent illnesses. Write those ages and doses exactly, they are high yield. Pause and recall. For a 15-month-old with night blindness, what are the 3 treatment days? Answer: day 1, day 2 and day 14, each 200,000 international units.
Scenario 2. A postpartum mother says her milk is not enough and wants to switch to formula. She also believes common myths. How do we counsel? Advantages of breastfeeding and the facility steps under the baby-friendly hospital initiative.
Start with clear benefits. For the baby, fewer ear infections, diarrhea and pneumonia, reduce risk of sudden infant death syndrome, better survival during emergencies because breast milk is safe and ready and it supplies antibodies tailored to the baby's exposures. For the mother, lower risks of breast and ovarian cancers, type 2 diabetes, hypertension and possibly cardiovascular disease. Economical, always available and fosters bonding. Emphasize exclusive breastfeeding for 6 months, then continued breastfeeding with complementary foods up to 2 years or beyond. Now, the BFHI, the Baby-Friendly Hospital Initiative, uses the updated 10 Steps to Successful Breastfeeding 2018. Think of them as a hospital checklist: facility policy, staff competency, antenatal counseling, immediate and uninterrupted skin-to-skin with early initiation, support with positioning and attachment, rooming in, no unnecessary supplements, responsive feeding, discharge support including community linkages and monitoring. Tell the mother that these steps, especially early skin-to-skin and avoiding prelacteal feeds, make milk come in reliably. Debunk myths. Colostrum is not dirty, it is the baby's first vaccine. Avoid teas, ghutti or water before 6 months. These reduce milk production and increase infection risk. Scenario 3. A 6-week-old infant comes for the first immunization visit. Beyond vaccines, what nutrition actions start or continue at this age? Also, what is the policy on vitamin A prophylaxis from 9 months?
At 6 weeks, we reinforce exclusive breastfeeding and begin vitamin D supplementation, 400 international units daily through infancy, per Indian Academy of Pediatrics guidance. Start in the first weeks of life. If the infant is largely formula-fed, ensure total intake approximates this amount. Counsel the family to maintain skin-to-skin, responsive feeding and appropriate latch. For vitamin A prophylaxis under the national program, remember the line you can write in exams. Total 9 doses till 5 years. The first dose is 100,000 international units, often alongside the measles rubella visit, followed by 200,000 international units every 6 months until 59 months. Document doses and schedule the next contact. Link the infant to Anemia Mukt Bharat at the appropriate age from 6 months to 59 months. Children receive bi-weekly iron folic acid syrup, 1 ml containing 20 milligrams elemental iron plus 100 micrograms folic acid with deworming from 12 months as per policy. Families often confuse vitamin A with iron. Remind them both programs run in parallel. Pause and reflect. What 2 sentences will you write for community posting? Answer: vitamin D 400 IU daily through infancy and vitamin A 9 doses from 9 months. Scenario 4. A school health survey shows a high prevalence of goiter in a district. Discuss the National Iodine Deficiency Disorders Control Program and how salt testing is done at the household level.
The National Iodine Deficiency Disorders Control Program, the NIDCDP, evolved from the old National Goiter Control Program. Its goals include bringing iodine deficiency disorders below 5% prevalence and ensuring 100% households consume adequately iodized salt, defined operationally as 15 parts per million or more at the household level and 30 parts per million at production. The program works through universal salt iodization, surveillance, laboratory monitoring, and communication. Household salt testing uses a rapid test kit. Here is the field method you can recite. Place a pinch of household salt on a clean surface, add 1 to 2 drops of the test solution, observe color change to a purple-blue range, and compare with the kit's color chart to judge whether iodine is present and at or above the 15 parts per million threshold. If no color appears, some kits advise a recheck with the second solution. Remember, RTKs are semi-quantitative, presence-absence, while labs use iodometric titration for exact values. Community actions after a high goiter survey: verify salt supply chains, promote packed refined iodized salt, discourage unpacked crystal salt, and coordinate with food safety authorities and wholesalers. You can cite that national surveys still find households below the 15 parts per million cutoff, so field verification matters.
Quick drill, 3 questions.
Go for it.
1. How do you treat a 15-month-old with night blindness due to vitamin A deficiency?
200,000 international units vitamin A on day 1, day 2 and day 14, plus diet counseling and infection management.
So, what are the 2 sentences you must say to a hesitant breastfeeding mother?
Breastfeeding protects babies from diarrhea and pneumonia and protects mothers from breast and ovarian cancers. And the BFHI 10 steps, especially immediate skin-to-skin and avoiding pre-lacteals, help milk come in and stay.
3. How do you explain salt testing in the household?
Use the rapid test kit, put a pinch of salt, add drops, purple means iodine, compare with the kit chart, aim for 15 parts per million or more.
Before we close, can you summarize a clean exam-ready template?
Sure. Write it as 4 lines. Vitamin A, treatment versus prophylaxis. Treat xerophthalmia with 8 specific 3 doses. Day 1, Day 2, Day 14. Prophylaxis under NHM is 9 doses from 9 months to 5 years, 100,000, then 6 monthly, 200,000. Breastfeeding, exclusive for 6 months, continued to 2 years plus. Benefits to infant and mother, support via the BFHI 10 steps. 6-week visit, reinforce exclusive breastfeeding, start vitamin D, 400 IU daily, plan vitamin A at 9 months, link to Anemia Mukt Bharat iron syrup from 6 months. NIDCDP, goal is at least 15 parts per million iodine in household salt, verify with rapid test kit, strengthen supply and behavior change where gaps persist.
That wraps our episode on micronutrients and infant feeding, vitamin A done right, breastfeeding supported the right way, and iodine deficiency controlled at the household level. Dr. Sharon, thanks for the crisp exam-ready walkthrough.
My pleasure. Remember the rhythm. Recognize early, dose right, support feeding, verify salt. If this helped, do subscribe, like, and drop your next topic in the comments.